My name is Malebone P Matsoso. I'm the Director General of Health. We are at the turning point and crossroads in the healthcare sector. And we are of the view that the manner in which we can change things for the better is establishing partnerships with the private sector, with civil society, and development partners. HASA is well placed to partner with us, but we have to set the rules on how we're going to work, agreeing on contracting models. Our first phase, of course, will be with GPs, but we're going to engage other allied health workers, pharmacists, physiotherapists over a period. But our priority will be private doctors, and then we'll also include others like HASA, private hospitals, and other partners. We look forward to building this health system in this country. It's about time we did it, but we have to do it right. We announced the NHI pilot districts. NHI pilot districts are an opportunity for us as partners to try various things, to come up with service innovations that can improve access and ensure that health is equitable. But the unit of planning will be a district, and within a district, we have to look at all partners within a district that provide health services. But that should be done in such a way that it improves access and it reduces costs to individuals. So to achieve that, we have to know exactly where the private sector partners are, what services they are rendering, and how best we can enter in these contracting models. We've started this initial phase. We've got a task team that is looking at GP contracting models, and we're going to be starting consultations with various partners, starting with GPs and other health professionals and HASA as a partner in health. We will be working with civil society as well, because we need community mobilization. Health is a safety net where other sectors have failed. So if we don't get it right, if we don't sort out health, then there's no hope. But I'm very hopeful that we will use health to change not only health, but other social ills of our society. The three streams that have been identified by the minister include specialists. South Africa does not have a lot of specialists, but for those that we have, both in the public and private sector, we have to structure the services in such a way that they can be accessed, but accessed specifically to help us reduce the burden of disease. We're seeing downward trend with regard to maternal mortality ratio, infant mortality rates, but we still have to do more, so that by 2015, when we report for the MDGs, we can say, yes, we've reached those targets. Some are achievable, and we can do it. Others would be difficult to achieve, but it requires innovative approaches. It cannot just be business as usual. So we have to work differently. And we see the contracting as a way, by facilitating the manner in which people access services, both public and private.